The latissimus dorsi is the large triangular-shaped muscle of the upper limb, which has an extensive origin from the posterior thorax and abdomen. The origins of the latissimus dorsi are from the posterior lip of the iliac crest. The spinous processes of vertebrae L5 through T7 and ribs 8 through 12 via the thoracolumbar fascia. The insertion is to the intertubercular groove of the humerus. Latissimus dorsi extends the arm at the shoulder. From a state of flexion, it moves the arm to an anatomical position or to a state of extension, and beyond this to a state of hyperextension. It also adducts the arm by moving it in a medial direction toward the midsagittal plane, and medially rotates the arm by turning the anterior surface of the arm toward midline. Latissimus dorsi is innervated by the thoracodorsal nerve. The origins of levator scapula are from the transverse processes of cervical vertebrae 1 through 4. The insertion is to the upper 1/3 of the medial border of the scapula. Levator scapula elevates the scapula and pulls the glenoid cavity inferiorly. It is innervated by the cervical nerves and the dorsal scapular nerve. The trapezius is the large trapezoid-shaped muscle located in the posterior thorax and neck. It may be separated into 3 groups of fibers: superior, middle, and inferior. The origins of the superior fibers are from the external occipital protuberance, the superior nuchal line, the ligamentum nuchae, and the spinous process of vertebrae C7. The insertions are to the lateral 1/3 of the clavicle and acromion of the scapula. With the origin fixed, the superior fibers elevate the scapula, gliding it toward the skull. The superior fibers also laterally rotate the scapula upward. With the insertion fixed and the muscle contracting on one side only, the superior fibers laterally flex and rotate the head and neck to the opposite side. With the insertion fixed and the muscle contracting on both sides, the superior fibers extend the neck. The superior fibers are innervated by the spinal accessory nerve. The origins of the middle fibers are from the spinous processes of vertebrae T1 through T5. The insertions are to the medial border of the acromion and the superior lip of spine of the scapula. With the origin fixed, the middle fibers adduct the scapula. This is a gliding movement toward midline. The middle fibers are innervated by the spinal accessory nerve. The origins of the inferior fibers are from the spinous processes of vertebrae T6 through T12. The insertion is to the tubercle of the spine of the scapula. With the origin fixed, the inferior fibers depress the scapula, gliding it inferiorly. The inferior fibers also laterally rotate the scapula upward. The inferior fibers are innervated by the spinal accessory nerve. The origins of Rhomboid Minor are from the ligamentum nuchae and the spinous processes of vertebrae C7 and T1. The insertion is to the medial border of the scapula. Rhomboid Minor elevates the scapula, adducts the scapula, and medially rotates the scapula downward by moving the glenoid cavity inferiorly and the inferior angle medially. It is innervated by the dorsal scapular nerve. The origins of Rhomboid Major are from the spinous processes of vertebrae T2 through T5. The insertion is to the medial border of the scapula. Rhomboid major elevates the scapula, adducts the scapula, and medially rotates the scapula downward by moving the glenoid cavity inferiorly and the inferior angle medially. It is innervated by the dorsal scapular nerve.